Hello, everyone. I'm going to start here in a minute or two, so just hold tight. All right, so hi, everyone. Welcome to GMS's Webinar Wednesday. Thank you so much for joining me today, as I'm so excited to discuss a very important topic with you. I will start by introducing myself. My name is Stephanie Ortel. I am a board-certified physician assistant here at Greenwich Medical Spa. My background is in plastic surgery with a focus on injectables. I work mostly in our Scarsdale, New York location, but also at our Westport location. To any of my patients listening, I miss you all so much. So who is GMS? We are an award-winning practice with over 15 years of experience. We have 3 locations located in Greenwich, Connecticut, Westport, Connecticut, and Scarsdale, New York, and actually plan on opening our 4th location this fall in Ridgefield, Connecticut, which is super exciting. We have been recognized as the top 1% of Botox and Juvederm providers in the nation, top 60 out of 20,000. We are #1 provider of cool sculpting in Connecticut and Westchester County and number 25 in the nation. We house the top 25 most loved injector awarded by RealSelf, and we have been recognized as expert injectors and top beauty doctor by New Beauty Magazine 2015 through 2020. And we are listed as one of the fastest growing companies by the 2019 Incorporate 5000 list. So what do? We specialize in non-surgical procedures, anything that can make you look younger or better without surgery, from non-surgical wrinkle reductions to body contouring, to hair restoration, to acne treatments, to even vaginal rejuvenation, which will be the topic of discussion today. Ladies, whether you want to talk about it or not, just like the rest of your body, your vagina is susceptible to signs of aging. If you're experiencing vaginal dryness, incontinence when you're doing jumping jacks or when you cough, if you are having painful intercourse, if you feel like your vagina is not as tight anymore, or if you're not having that earth-shattering orgasm, you are not alone, and this webinar is for you. Maybe some of you are noticing more of these symptoms now that many of us have been at home with our significant others all day. But either way, in the next 30 minutes or so, we will discuss why you're feeling this way and talk about 2 non-surgical solutions, ThermiVa and the V-Shop, which can help treat some of these issues. I will first describe what the treatment is, who the treatment is targeted for, and finish up with a live Q&A. So what causes us to feel this way? The causes can be due to childbirth. It can be due to hormonal changes from menopause or simply due to the natural aging process, which causes a loss of firmness in the vaginal area, which you might be feeling less confident. Okay, so the first treatment I'm going to discuss with you is called ThermiVa, with over 115,000 treatments performed worldwide. ThermiVa is a non-surgical vaginal rejuvenation technology that uses radio frequency energy to stimulate your own collagen production. Yes, lack of collagen is not just responsible for wrinkles on the face. It's to blame for many of the issues you're experiencing here too. By boosting collagen with a series of 3 ThermiVa treatments, you will experience tighter tissues inside and outside of your vagina, increased blood circulation, and improved vaginal moisture. With a restored tightness and firmness, you will also see a decrease in stress incontinence, so you'll once again be free to laugh without worry. How does ThermiVa work? ThermiVa gently heats vaginal tissue with radio frequency energy with a patented electrode that was designed to treat internal and external vaginal areas. Thanks to radio frequency heat, the body increases collagen production in the treated areas, leading to stronger collagen bands and tightened skin inside and out. So let's take a look together at this photo of the cellular composition of the vaginal wall. You can see the thickness of the vaginal tissue, which is the purple band. In the first photo is thin with contour regularities. After 3 treatments of ThermiVa, there is visible thickening of the vaginal tissue and the wall is smooth. What to expect. During the ThermiVa treatment, the thin diode wand is placed on the areas to be treated. Radio frequency energy, perceived as alternating warmth, is passed through the wand onto tissue. The full treatment takes about 30 minutes. 20 minutes is spent on the internal vaginal canal and 10 minutes on the outer vaginal anatomy. The patient should be prepared for the treatment with shaving the day of the treatment. If someone is experiencing vaginal dryness, we can tailor the treatment to have more time spent on the internal vaginal canal. ThermiVa treatments are generally performed in a series of 3, but you will begin to see immediate changes after the first visit. Upon completion of the series, you may wish to continue treatment to achieve additional results. To sustain your ThermiVa results, we recommend visiting for 1 to 2 maintenance treatments a year. All right, so now we will watch a quick video about ThermiVa. This is gonna be great.
Just like the rest of your body, your vagina is a sign of aging. Childbirth, during menopause, or simply due to the aging process, a loss of firmness in vaginal suffering from stress incontinence, or even experiencing pain with sexual intercourse. Rather than thinking that personal happiness and sensuality is something you have to let go of, consider ThermiVa at the spot. This non-surgical vaginal rejuvenation treatment offers significant results and renews the concept of pleasure. ThermiVa is a safe and effective treatment that uses thermal energy from radio frequency to treat vaginal dryness, tighten loose skin, improve sexual function, and tighten and strengthen the pelvic floor, with immediate results lasting up to 1 year or more. Whether your concerns are medical or cosmetic and you are unhappy with the way your vagina looks and feels, come visit us at Greenwich Medical Spa and experience non-surgical rejuvenation with ThermiVa.
All right, so as you could see in that video, you're reclined back and relaxing. Like I said before, the treatment itself is very comfortable. So you could bring a headphone or headphones in your phone and listen to music, bring a book to read, and just relax. Use those 30 minutes to treat yourself. Okay, so next up, I will show some remarkable before and after photos of the external vaginal anatomy after the ThermiVa series. Please keep in mind that these photos are extremely personal, so be mindful of those around you. Okay, here we go. This is a 35-year-old woman who was concerned about the appearance of her labia majora and was starting to experience a more difficult time with lubrication during sexual intercourse. She underwent 3 ThermiVa treatments, started noticing an increase in vaginal wetness after the second treatment, and saw an amazing improvement in her labia after all 3. This is a 29-year-old who is starting to see changes in her external vaginal tissue. Although her before photo appears quite normal, ThermiVa is a great treatment to prevent further aging, as well as add a little plump to the tissue. The after photo shows vaginal tissue that is smooth and plump, and she was very happy with her results. This is a 42-year-old mother of 3 that arrived to our office looking for a way to help her get as close as she could to her pre-baby body down there. She was feeling less tight during intercourse, was leaking with exercise, and noticed labial skin laxity. After completing all 3 ThermiVa treatments, her vaginal wall tone improved, increasing her stimulation during sex. Her exercise-induced incontinence diminished, and as you can see, there was an amazing improvement in her labial tone. This here is a 51-year-old mother of 2 who was complaining of the changes of her labia after the last 20 years. She felt less lubrication and stimulation during sex and felt that her underwear and bathing suits were not laying as flat. After the series of 3 ThermiVa, she felt more tight and stimulated during sex, and as you can see, she had a huge improvement in labial laxity, which looks great. Finally, this is a 34-year-old mother of 5 complaining of vaginal looseness and labial laxity. She also had severe stress incontinence, so every time she would sneeze, she would leak. After her 3 ThermiVa treatments, she felt more confident in the bedroom, but also had almost a complete resolution of her stress incontinence. Alrighty, so the next treatment of discussion is the V-shot. So ladies, are you ready for the ultimate orgasm? You've heard about the G-spot, and you could be one of those women lucky enough to have multiple orgasms. But when the big O becomes a challenge, it's time to find a solution. With aging, childbirth, menopause, or other types of trauma, vaginal function diminishes, and sexual pleasure may go right along with it. What's actually going on down there is decreased blood flow and slow cell turnover. By reversing this trend, you can have more G-spot stimulation, more clitoral stimulation, and yes, a better orgasm. So let's go to Anatomy 101. Let's start with our clitoris, which has an external part, but also an internal part that most people do not realize. The clitoris has approximately 8,000 nerve endings, which is more than anywhere else on the female body. The penis only has 4,000. The distance of a woman's clitoris from her vagina may affect her ability to orgasm. A recent study published in the Journal of Sexual Medicine found that women who have a greater distance of their clitoris to the vaginal canal have a harder time achieving orgasm. This means some of us are anatomically predisposed to have a harder time with orgasm. Let's continue on to Grafenberg spot. Less than 10% of the population can achieve orgasm from G-spot stimulation alone. The G-spot is a bean-shaped area of the vagina located 1 to 3 inches up the interior vaginal wall. Researchers are indecisive about the function of the G-spot. Some say that it's an area in the vaginal canal with increased blood supply and innervation, but some believe that penetration in this area stimulates the deeper part of the clitoris found near this area. Like I mentioned before, the clitoris has a deep-rooted internal portion. So what exactly is the V-shot? The V-shot is a non-surgical treatment that uses growth factors to stimulate the growth of new cells in the vaginal area. The V-shot uses platelet-rich fibrin matrix, PRFM, from your own blood, and when these potent growth factors are injected into the clitoris, vagina, and labia, they boost cell turnover and performance. Thanks to more and better cell production and function, you will also experience increased blood flow. As a result, you enjoy enhanced sensitivity, fullness, and lubrication. So at your V-shot appointment, we will begin by numbing your vaginal area. And we use very, very strong numbing cream, ladies, so do not worry, I promise. While you wait for the numbing to reach its maximum effectiveness, we will draw your blood and put it through the cephalcentrifuge to separate out the platelet-rich fibrin matrix. This concentration of growth factors from your own blood will be injected into the clitoris, labia, and vaginal walls as needed to boost your cell production and functioning. Once these growth factors are injected into your vaginal area, they will begin to boost blood flow, renew sensitivity, and make more orgasms possible. But before I leave this slide, I'd love to point out that PRP, PRFM, the same plasma we're using to reactivate this in this treatment, is currently being used in experimental trials for COVID patients. To fight a virus, the immune system develops antibodies, which are proteins that bind to the parts of the virus and impede the infection. These proteins are rich and plentiful in our plasma, and in these cases, the antibody-rich plasma is taken from someone who has survived the infection and infused into a COVID-positive patient to treat the infection, as well as prevent future infections. Cool stuff, right? So post-care and results. You can return to normal activity immediately post-treatment. You'll be sent home with a panty liner, as you can expect some spotting afterwards. You will notice an improvement to the treated area once the numbing has worn off, but you will need to avoid having sex for 7 days after the treatment. So we could say the real results begin on day 8. Results from the V-shot should last 6 to 12 months, and we recommend that you return once a year for maintenance. It takes about 3 full months to see the full effect. So who is a good candidate for vaginal rejuvenation? Anyone who is experiencing vaginal dryness, incontinence when you jump or cough, also known as stress incontinence, which affects 20% of women, discomfort during sex, labial volume loss, lack of vaginal tightness, a feeling of interior or exterior looseness, decreased ability to climax, decreased libido, chronic pain from trauma or childbirth. Who is not a good candidate for vaginal rejuvenation? Anyone who has an active STD, yeast infection, or UTI, any history of gynecological cancer, uterine or bladder prolapse, anyone who has an allergy to lidocaine, has systemic cancer, is undergoing chemotherapy or steroid therapy, anyone who has history of blood or platelet abnormalities, and of course, anyone who's pregnant or breastfeeding. Okay, so at this time, I'm opening up the webinar to questions. So please feel free to ask me any questions you may have. So I have the question, can you do ThermiVa and the V shot at the same time? So my suggestion would be to do the ThermiVa series first, and then you could get the V shot anytime after that. You would not want to do it the other way around, because when you do the V shot, we're injecting some growth factors into the area, and we don't want to impede the result by applying any kind of heat to that. So I would do the ThermiVa series first, and then, you know, as soon as you finish your 3rd treatment from ThermiVa, you can come in and do your V shot. Any side effects? So with ThermiVa, like I said, you can go and do your normal activity the same day. You can have sex that same day. There's very minimal little side effects with ThermiVa. It's a very safe treatment. The V shot is comfortable. You might experience a little bit of discomfort in the vaginal area that day and spotting, like I said, but we are very trained injectors, and it's a very safe treatment as well. What is the oldest a person can be to get the treatment? There is no age cap on this treatment, I promise. I've treated women of all ages. And depending on what your goals are, we can tailor your treatment plan. So that's something that we could discuss during your consultation. But don't worry. How does PRP help with dryness? So PRP can regenerate healthy tissue, thus more lubrication being secreted in a healthier overall vaginal environment. This actually leads to more comfortable sex with anybody who experiences pain with sex. Does ThermiVa hurt? It is very comfortable with a slight warmth feeling throughout. Most people actually say it feels good, so don't worry about that. And how many ThermiVa treatments? So you do 3 treatments 4 to 6 weeks apart and 1 to 2 for maintenance. Any pain during the treatment. So with ThermiVa, like I said, it's just warmth. With the V shot, we use a very, very strong numbing cream. Out of all of the treatments or V shots I've given, I would say 99.9% of them don't feel a thing. Sometimes you can feel a little bit of pressure, but it's not going to be anything crazy painful. I know you're thinking of the clitoris being a very sensitive area, but trust me, our numbing cream works very well. Is this a substitute for Kegel for leakage? That's actually a very good question. No, it is not. So Kegels work to strengthen your muscle tone. This is working on your vaginal tissue in a different way. It's not affecting the actual muscles. So I always suggest that my patients keep up with their Kegel exercises because those work very well as long as you're doing them as often as you should. I have urinary incontinence. How many treatments will I need to resolve that? It's depending on the severity of your urinary incontinence. I get a very good result with the 3 ThermiVa, but you can always do more than that if you want more of a result afterwards. And is ThermiVa better for that or the V shot? Honestly, they both work great. I would do them both if it's a very severe case of urinary incontinence. And like I said, I would do ThermiVa first and then finish up with the V shot. ThermiVa, if you don't do maintenance, does your body revert back? So with any kind of cosmetic treatment, if you're not keeping up with maintenance, your normal body aging is going to occur. So it's not necessarily going to revert back, but it's going to continue to age in the normal process. So if you are doing that series of 3 and investing in that, then you'd want to keep up with just having to do 1 a year. It's worth it, I promise. So as I have aged, I see a loss of volume down there versus the photos you showed me. Can you put volume back? So during the V shot, we actually inject some of the plasma into the labia, which increases the tissue and collagen production to give more plumpness. You can actually inject dermal fillers into the labia as well. So if you're concerned about like a severe labial volume loss, we can discuss that as well at your consultation. That's a great treatment. How do you know to do maintenance once versus twice a year? So that's based on your goals. If it's someone who has very severe urinary incontinence, that is someone who's going to want to do it twice a year. If you're only doing ThermiVa for maybe prevention or just light plumping of the labia and vaginal wetness, then you could get away with doing it once a year. But that's something, you would see what your results were after the 3 treatments and go from there. All right, any more questions? Okay. So if you guys think of any more questions, please send them to our email, yourSkincareSpecialist@GreenwichMedicalSpa.com. I'll repeat that, yourSkincareSpecialist@GreenwichMedicalSpa.com. Also, please connect with us on YouTube as well as follow us on Instagram and Facebook for new updates and educational information. You can also subscribe to our monthly newsletters and get the latest updates and promotions. So thank you guys so much for having me today. At the end of this webinar, you will receive a brief survey that we hope you can fill out so we can improve future presentations for you. Join us next Wednesday, May 12th, for our Instagram Live on everything you need to know about lip injections. So again, that's next Wednesday at 12. We cannot wait to see you all soon. Stay safe and healthy, and thank you so much for tuning in. Bye, guys.